I want to say something about evaluating risk and making a decision of whether or not your acute coronary syndrome patient needs to be treated now, or that treatment with mechanical reperfusion can be delayed, or if at all. There's a very well-validated TIMI risk score. That TIMI stands for thrombolysis and myocardial ischemia, which is the name of several trials done here in the United States. And after hundreds of thousands of patients, we now know how to stratify risk with this risk score. So take a look at these bullet points, each one of these in the TIMI risk score analysis for your patients with unstable angina or non-ST segment elevation myocardial infarction. Each bullet point equals 1, and this is simply a point score system. We simply add them up. Age greater than 65, known coronary artery disease, if they've had aspirin in the last 7 days, at least 3 of the traditional coronary artery disease risk factors, that is age, cigarette smoking, family history, diabetes, high blood pressure, high cholesterol, etc. ST segment changes, either depression or elevation, more than 2 episodes of severe angina in the last 24 hours, and again, elevated cardiac enzymes. And let me tell you, each bullet point has 1, and from 1 all the way up to 7, we actually have validated that patients anywhere on the spectrum, we can tell what the risk of going on to have either a major fatal myocardial infarction or a major myocardial infarction in the next 2 weeks is if we do nothing. And obviously, we're not in the business of doing nothing. We're in the business of doing something. And that something is finding the occluded artery and opening the artery. However, this TIMI risk score is helpful for saying who needs to have that artery opened right now versus in a delayed or deferred manner. Here's an example of how we would use this on the wards. A 73-year-old woman whose past medical history includes high blood pressure, she smokes, and hyperlipidemia. 7 years ago, she had a heart cath and had a 60% stenosis in her right coronary artery that was treated medically. Last night, she had 3 episodes of angina at rest, and her chronic medications are aspirin, the statin, atorvastatin, and the beta blocker metoprolol. Her chest X-ray shows a large heart. Her troponin, CK, and CKMB, those are the myocardial enzymes that we check, are all normal. So what's our TIMI risk score? Well, she's older than 65. She gets a point for that. She has 3 traditional risk factors. She gets a point for that. She gets a point for known CAD. She gets a point for having more than 2 episodes of rest angina. She's been on aspirin. She gets a point for that. And so that all adds up to, especially when you look at the EKG and you see her ST segment depression in the lateral leads V4, V5, and V6, that adds up to a TIMI risk score of 6, which is a very high TIMI risk score. In the next 2 weeks, if we do nothing, her risk of a fatal myocardial infarction is as high as 40%. So this is somebody that you would do the TIMI risk score on and say her risk is relatively high. We need to revascularize her as soon as possible.